Good day, dear panelists. I'm Louie Sapul together with Johanna, Servande, Franch, Solis, Ahyana, Superlativo, and Tejero. We are third-year nursing student researchers from the University of St. LaSalle, and today we are honored to present our study entitled Echoes of the Siren, the lived experiences of ambulance drivers in transporting patients during emergency situations.
Ambulance drivers play a vital role in ensuring safe and timely patient transport. Their work goes beyond driving, requiring quick decision-making, adaptability, and coordination with healthcare teams despite risks such as traffic hazards, physical strain, long hours, and emotional stress. However, they remain underrepresented in research, particularly in the Philippine context, highlighting the need to explore their lived experiences.
This study supports the Sustainable Development Goal 3 by promoting the well-being of frontline responders and aims to inform policies, training, and support systems. This study aims to explore the lived experiences of ambulance drivers in transporting patients during emergency situations.
This study utilized a qualitative phenomenological design to explore and understand the lived experiences of ambulance drivers, particularly how they perceive their roles, manage occupational challenges, and used coping and adaptive strategies during emergency patient transport. Through in-depth interviews, the researchers gathered detailed personal narratives and identified recurring themes related to the emotional, physical, and psychological demands of emergency transport.
6 ambulance drivers from Negros Occidental were selected through maximum variation. The participants were aged 21 to 60, at least high school graduates, employed in public or private institutions, and had at least 2 years of experience in ambulance driving and were actively engaged in patient transport during the study period.
Those who were not actively working as ambulance drivers, had less than 2 years of experience, or were unable or unwilling to participate were not included in the study. Although the study initially aimed for 8 to 10 participants, data collection concluded at 6 due to data saturation.
Data were gathered using an interview guide validated by a registered guidance counselor of the university to ensure clarity and appropriateness. The instrument consisted of 3 parts. First, the participant's demographic profile. Second, the overarching question, how would you describe your overall experience working as an ambulance driver when transporting patients during emergency situations? And third, 3 follow-up questions focusing on their roles, challenges, and coping strategies during emergency transport.
Now for the findings of our study, from the in-depth interviews conducted among 6 ambulance drivers from public and private healthcare institutions in Negros Occidental, most participants belong to the early-middle adulthood age group, specifically aged 31 to 50 years old, possessed at least secondary or tertiary education with emergency-related training, and had varying years of experience in ambulance service. All participants also held valid driver's licenses and emergency-related certifications, reflecting their preparedness and active involvement in emergency patient transport.
From the analysis, 5 major themes emerge. The first theme, carrying lives through safety-centered driving, reflects the driver's strong emphasis on patient safety as their primary responsibility. Participants describe preparing equipment before transport, making immediate decisions during transfer, and regulating speed based on the patient's condition. These findings indicate that ambulance drivers consistently balance urgency with safety, demonstrating controlled and situation-based decision-making during emergency transport.
The second theme, bearing emotional strain while staying composed, highlights the emotional demands of the role. Participants express feelings of fear, stress, and pressure during emergency situations, yet emphasize the need to remain calm and focused. This suggests that emotional regulation is a critical component of their performance, allowing them to function effectively despite high-stress conditions.
The third theme, enduring roadside and system barriers, reflects external challenges encountered during transport. These include traffic congestion, uncooperative road users, unclear directions, and occasional mechanical issues. The findings show that ambulance drivers must continuously adapt to unpredictable conditions while maintaining efficiency and patient safety.
The fourth theme, coping through inner strength and sense of purpose, reflects the internal coping mechanisms used by ambulance drivers to manage the physical and emotional demands of emergency transport. Participants describe prayer, mental regulation, emotional control, and finding meaning in helping and saving lives as important in maintaining focus, emotional stability, and motivation despite repeated exposure to stressful situations.
The fifth theme, seeking stronger support through relationships and systems, reflects the external sources of support that helps ambulance drivers sustain their work during emergency transport situations. Participants emphasize the importance of family support, peers, and restorative routines, trainings, opportunities, organizational support, and professional recognition in helping them manage stress, maintain motivation, and continue functioning despite the demands of their work.
Overall, the findings demonstrate that ambulance drivers consistently integrate safety-centered decision-making, emotional regulation, and adaptive strategies in performing their role during emergency transport. These patterns reflect how they respond effectively to physical, emotional, and environmental demands in high-pressure and unpredictable situations, while maintaining patient safety and operational efficiency.
With that, allow us to present the culmination of our research through our simulacrum. Centered on the emergency siren light displayed in the poster, more than a symbol of emergency response, the siren reflects the lived experiences of ambulance drivers as they transport lives under urgent and unpredictable conditions. Its steady light represents resilience and emotional endurance, while the surrounding darkness symbolizes the environmental and operational challenges they encounter.
Therefore, it can be concluded that ambulance drivers demonstrate continuous adaptation and resilience in managing the demands of emergency transport. These findings align with Roy's adaptation model and human systems model, showing how drivers respond to stressors through coping and support systems. The study also highlights the importance of strengthening nursing education and awareness regarding emergency response, occupational health, and holistic care for frontline healthcare workers.
Based on the findings of this study, it is recommended that policymakers and LGUs strengthen EMS systems through improved policies, safety protocols, and resource allocation.
Hospital administrators and EMS personnel should enhance coordination, training, and operational support, while occupational health professionals may develop targeted interventions such as wellness and stress management programs.
Ambulance drivers are encouraged to continuously improve coping strategies and advocate for safer working conditions, while communities should promote awareness and cooperation during emergency situations. Future researchers may use this study as a foundation for further exploration of emergency transport, occupational stress, and healthcare support systems.
You may scan the QR code for our references. Behind every emergency response is an ambulance driver carrying not only patients, but also responsibility, resilience, and the commitment to preserve life despite uncertainty and pressure. As future nurses, may this deepen our appreciation for the importance of teamwork, compassion, and holistic care in supporting both patients and frontline responders. Thank you, and God bless.